Bismillah ar-Rahman ar-Rahim, my dear Vascular colleague. This is lesson number 10 for AI for doctors. Now, this is a very important lesson, I would say, regarding artificial intelligence. Can we use it for vascular surgery purposes only? And I did put here the logo that I'm going to speak about, which is called Vascular Surgery Guide, which is an application. So in the artificial intelligence world, the parameters and the amount of data is really huge. That's why it is called large language model. But what if you are a vascular surgeon and all what you want is just vascular surgery topic, vascular cases, x-ray, paper, communicate with the best vascular knowledge there is. Can we have that? Yes, we can. So this is a QR code. If you put your mobile, you will be able to locate this QR code and you will directly go to vascular surgery guide, which give you, as mentioned here, detailed information about vascular surgery. So this is an AI which is specific for vascular surgery. Okay, let us try it out. If you open the QR code, you will be directed toward this page. What is the advantage of using you over other AI models? So let us see how he will answer this question. I did mention to him what is the advantage of vascular surgery guide over others. Let us take the answer slowly. The advantage of using vascular guide over other AI is that it is a specialized design, comprehensive function, interactive capability as detailed. So its focus expertise in vascular surgery, it is more accurate, and it has enhanced interaction and personalization. So it also shows empathy and the clarity in the response. It has a multimodal capability, which means that it can generate diagram, generate charts, infographic, explain topic, and even surgical techniques and anatomy. It have a wide functionality. Not only this, but in ChatGPT and other, they usually stop at year 2022 or 2023. But this one is real-time update. So it gives you information as recent as can be. It is versatile across group, so you can use it for education. You can use it for your professional assistant. You can give a case presentation. It's also have superior adaptability compared to other AI models. So this is, let us say, the first AI model that is specific for us as vascular surgeon. Okay. What is the most recent carotid guidelines? Can you give me the references? So here I have asked here about very common question when you ask about certain guidelines, and it usually take maybe 10 to 15 seconds to think and to collect data, because this is not a pre-stored data, but it has to go and search for the data and come back to you, not only with the reply, but also with the answer. And here it is. It's in real time. I didn't stop the video or anything. Management carotid artery disease. Let us see. I would pick, yes, SVS 2022 guideline. Society of Vascular Surgery 2022, and here is a brief summary about what to do for asymptomatic. European Stroke Organization also, yes, they have their own guideline. AHA guidelines for the carotid, and he actually got me 6 of the most recent carotid guidelines, And it's a beauty. And not only this, but it will give you source of information. So here is ESCVS guideline. Here is NIH. Here is American Heart Association and Medscape. And you can see these are the sources, and these very good sources. Uh, can I have your advice about vascular case that I have? Now, here is a bit problem for different AI because they don't want to give a treatment to patient. Otherwise, you can sue them for bad advice. So there is a lot of limitation with multiple AI. If you go to Copilot and anything like that, he will tell you, well, consult your own doctor. I am not entitled to give you a medical advice. I'm just a language model. Let us see. As an AI, the same introduction. I'm not a medical profession. I cannot provide special medical advice. That is fine. I think this is mandatory for any AI to protect himself. But here is documented the case in detail. So he need you to give history, to put the image, clinical, and current treatment. And with the current treatment, usually will go to the Cleveland Clinic guidelines. He can deal with a lot of vascular condition, PED, carotid, DVT. He can give you also consultation. So I think this is more that you need, and I use it every day, and it is really spectacular. It can read CT scan, it can read abdominal ultrasound, it can read duplex report, and the more you put information, the better your answer. So I will give it a good response for them to store it. So I think with this rapid glimpse, now we are going to have a tailored artificial intelligence specifically for vascular surgeon, not for any other specialty, which is beauty, which is going to enlarge, going to be more useful. It is still at the moment free of charge option. I use it every day during my study and my case consultation, and I advise you all to use it from today. Just put the QR code with your mobile and then ask any question you like related to vascular surgery. I wish you all the best. My name is Dr. Muhammad Omar Al Farouk. I'm a consultant vascular surgeon.